Families whose children are undergoing a surgical procedure usually have lots of questions, with an understandable dash of anxiety thrown into the mix. One hospital in Wisconsin has developed a great way to keep families calm, informed, and feeling good about the care their child is receiving when facing surgery. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hitterly, senior writer for AHA. Children's Wisconsin, a Milwaukee-based medical center, has developed an app it calls The Patient Journey to keep families looped in at every single stage of a surgical procedure involving their child. The app sends reminders about preparing for surgery, as well as what to expect afterward. Families also receive follow-up information about the recovery process, pain management, future appointments, and other information to support healing. In today's podcast, two Children's Wisconsin caregivers outline the app's many advantages and promising results with Julia Resnick, Senior Program Manager at AHA. Let's pick it up with Julia.
Thanks, Tom. Hi, I'm Julia Resnick, Senior Program Manager at the American Hospital Association. Today's podcast is part of the Value Initiative, which highlights how hospitals are improving value and affordability for their patients and communities. These members have implemented strategies that enhance the patient experience, improve quality, and lower cost. In today's Members in Action podcast, I will be talking with Dr. Kim Cronsell, Medical Director for Digital Health and Experience, and Dr. Cecille Sulman, Professor and Chief of the Division of Otolaryngology at Children's Wisconsin. We'll be discussing Patient Journey, their digital patient engagement tool. Drs. Cronsell and Soulman, thank you so much for joining me today. Let's jump right into our conversation. So I think it would be helpful to start with some background on Children's Wisconsin. Can you talk a bit about your hospital and the community that you serve?
Yeah, absolutely. So Children's Wisconsin is a very unique entity in the Midwest here. We're located in southeastern Wisconsin in Milwaukee, but we have a very broad reach. So we make nearly 2 million connections with kids and families in Wisconsin and beyond every year. We have 25 primary care locations, and they see about 275,000 patients per year. We have more than 70 medical specialists who see almost 400,000 specialty care visits yearly. We have a level 1 trauma center that sees about 70,000 kids a year. But we also have a lot of community-based services as well. So we have 17 behavioral health care clinics and 32 mental and behavioral health services throughout southeastern Wisconsin. We are also located in a number of schools and actually see about 15,000 kids per year in the school system. We house the Wisconsin Poison Center, which gets about 35,000 calls every year as well. So our main hospital has about 300 beds, is a level 1 surgery center, a level 1 trauma center, and a level 4 neonatal intensive care unit. We're very unique in that we have over 70 pediatric ICU beds. We also have a second location in the Fox Valley that has over 40 beds and 22 NICU beds. So we're very dynamic and broad-reaching organization. Also helps support kids in foster care and adoption, reaching more than 3,500 kids annually.
And one other thing we're proud of is that we have a lot of multidisciplinary clinics, and we have a special needs program that helps service children with complex health care needs. And I think that there's an amazing relationship between primary care and specialty care. Our division was granted NCQA designation for patient-centered specialty practice, which is pretty uncommon at this time. And our primary care specialties, urgent care, and EDL are all designated patient-centered medical home. So we're proud of those achievements as well.
That's great, and quite a scope of work and patient population that you are working with. So I'm interested in what was the problem that you were looking to address, and how did you know that it was an issue?
So back in 2014, Lori Newton, one of our nurse practitioners, and I were concerned that our readmission rate was high. So we had been working on various aspects to reduce readmissions after surgery and reduced readmission to or visits to the emergency room after surgery. So we had done many pieces of working on that with respect to pain management, communications with families, but we realized we had a lot of phone calls after surgery. A lot of parents had concerns. So how could we support them better? We had always looked at the patient's journey with us as episodic. So we realized that we were being very provider-centric and that we really focused on patients at the point of care. So meaning that when they show up to the hospital for their consultation, as well as the day of surgery. So very limited contact, and we recognize that the patient journey extends far beyond that. It extends before the patient even gets to us when they're with their primary care physician, as they're prepping for surgery and as they're recovering from surgery. So we thought that, well, if we could get text messages from the vet, from the dentist, from a hairdresser, as providers, we should be able to message the families outside of the point of care service with us so that we can support them throughout their journey. Children's Hospital of Wisconsin was incredibly supportive when we went to them with this proposal for a text message app. They support us 100% and help us develop this. And we were very focused on that. It should be called the patient journey, so we could always keep in our view that this is the patient's journey, not just their point of care service with a provider.
Great. And so you've mentioned patient journey. Can you tell us a little bit more about what patient journey is and how it addresses the issues you identified with your patient population?
So how the patient journey text app works is prior to surgery, we will push messages out to families, reminding them about day of surgery, reminding them about nothing by mouth instructions. We can even message them during surgery if there are any concerns. And then we developed videos for after surgery. So periodically after surgery, every day or two, the family will get supportive text messages and links to videos that talk about recovery, what to expect for pain, how do you support your child during this period of time, how do you maintain hydration, what are some tips and tricks. And then recently we added a final text message at 14 days after surgery if a family has received narcotic, how to dispose of it, and links to videos on where to do so. So this has been an incredible support for our family. We were published last year in one of the International Journal of Pediatric Otolaryngology, in which we actually surveyed the families. So we looked at 85 families who went through the Patient Journey app. And of those families, there were no visits to the emergency room and there were no readmissions. And the families felt that they were very supported throughout the process.
That is so great to hear. Do you have any stories or examples to help this come alive for our listeners?
Yes, we feel based on our survey of families that this has been a very successful journey for most. But what was disconcerting is although we were celebrating our reduction in readmission rate, previously, before we began our journey, our readmission rate to the hospital and visits to the ED in total was close to 10%. And after we had implemented a series of initiatives, including the text message app, we noted that we had decreased that number down to about 5 to 6%. But when we looked at it a little bit more carefully, one thing became clear. There was a disparity. So if you looked at our Caucasian patients, the rate was truly about 5 to 6% and even lower. When we parsed it out to African American and Spanish speaking, what was really disconcerting was that the readmission rate and revisit rate for African Americans was twofold of Caucasians and threefold for Hispanics or Spanish speaking. About a year and a half ago, we looked to address that. We targeted our Spanish speaking population, and we had the videos dubbed into Spanish, offered all our educational materials into Spanish. And currently, as of today, the readmission rate now has dropped from threefold down to less than twofold, which mirrors our African American revisit readmission rate. So we feel that we've had a win with our Spanish-speaking families, so they feel more engaged. They feel that they understand more what to expect after surgery.
That's fantastic. And I know you started getting into this, but we're really interested in what the impact has been on this work, both for your hospital and the community.
So the impact has been for the patient journey app in particular that not just otolaryngology, but orthopedic surgery uses this app, other surgical services.
This app falls into our digital health and experience team now. We have over 55 different care paths that are including specific locations as well as the translated care paths that Dr. Soulman was just mentioning. For 2019, we're actually on pace to send out more than 23,000 messages to nearly 2,400 families. Most of our patient journeys are around specific events or procedures, but we do have some that are not, and we even have a bereavement program for parents that have lost a child where they'll receive a message about once a week after that loss that just gives them a little piece of encouragement or links to inspiring ways to kind of move on. So we've really found a very broad way to use this tool across the entire Children's Wisconsin system.
That is wonderful. And when we had talked before, you had mentioned that you all have a value equation that you use to frame this work. Can you talk about that a little bit?
Yes, specifically in the Division of Pediatric Otolaryngology, we have a value equation that looks at, from a family perspective, how do we provide value? So looking at the quality piece of it, we call, so value equals quality plus experience over cost. And so quality experience, we aligned our practice based upon evidence-based resources through our academy. And so we continuously re-examine our practices, and we also ensure that we're uniform so that there is not a confusion between what one physician says between another postoperatively. So our families and our nurses feel confident about our recommendations after surgery. And then we've aligned our perioperative care within the hospital, so everything is alike. We all e-prescribe our prescriptions for Tylenol and Motrin, and if needed, oxycodone, so that's facilitated access to medications. We've provided for a surgical journey some processes where we can fast-track some children into surgery, so we could see them on one day and then fast-track them 2 days later into a surgery to facilitate their needs. We've done education for the family as well as the nursing, in addition to the text phone app and our YouTube videos. We've done some stepping stones in which the families are engaged in the process. So they own it, what the expectations are and what their concerns are, and they have to do a teach back or demonstrate understanding of what the expectations are for surgery as well as any other additional concerns they have. So that's our quality and experience. And then when we look at cost, we look at our resource utilization. We've streamlined our equipment in the operating room. We've looked at our time studies to make sure we're efficient in the operating room. We've also importantly decreased our readmissions in our emergency room visits. So overall, we feel we've increased the value for our patients and also reduced costs.
Absolutely. Thanks so much for sharing all of that. So I'm sure that as you've been implementing this and scaling this across your hospital, you've probably learned some lessons that would be helpful for others who are trying to implement something like this in their hospital. Can you share what some of those lessons learned have been?
One of the lessons I've learned is being a specialty practice, how do you ensure you get the right patient in at the right time? So what we've learned is that the best way to sort that out is to partner with your primary care specialist to see what would help facilitate that. And one of those pieces is actually education. What are the most recent guidelines for a procedure? So one of the things that we did was we actually leveraged our EHR. We put in within our referral, so if you were to click on referral to ENT, we actually inset the guidelines for surgery. So our most common surgeries are tonsillectomy and ear tubes. So within that, we have nice chunky buttons. So it's not a hard stop, but the primary care providers can see when is it appropriate to send a patient on in consideration of surgery. So the guidelines are updated where needed, and it allows for conversation to happen between the primary care and the family before referring on. So I think that aspect of right patient, right time was a great lesson for us to learn. That way patients are prepared for the possibility of surgery. And that was one lesson that we learned. Another lesson learned is you really have to re-examine your processes. So even though you may have some wins with an overall reduction, you can't stop there. You have to utilize social determinants of health to help guide you. Currently, our future lies in examining disparities. Actually, one of our goals is to hopefully engage families with community navigators. So if we can create a tool, a surgical risk tool based on social determinants of health, your zip code, your ethnicity, your language, that if we have a risk assessment that flags, then we can engage our social worker and a community navigator to help round on a patient before surgery in their home. And then knowing this navigator, the family can then visit with them afterwards to ensure they have all the tools that they need to help care for their child at home.
Yeah, I would add on, I think Dr. Soulman did an excellent job describing some of the really important lessons. So just want to highlight that what we've learned throughout this and some of our other digital initiatives is really the need to sort of rethink the workflow and not just try to recreate what you're currently doing in a different modality, but make sure that you're doing what's right for the patients and the providers. They can both be more efficient and really sort of redesign the entire process and engage with providers and patients when and how they want to be engaged with.
Yeah, one way to optimize the family's time and reduce waste of resources or extra appointments is use of the core experience of the double AMC, so the coordinating optimal referral experience. So multiple specialties are engaged in this, where primary care physician may send referral through our EHR, and the specialist will pick up that referral and then decide, is this a patient that we can manage, co-manage together through some recommendations? Is this a patient who the primary care can manage alone, or is this a patient who should be referred into the office? The wonderful thing about this is I think it's a great opportunity for teaching. Once again, knowing what the best practices are in our specialty, we have the opportunity to convey those. Sometimes I'll send links in with a referral comment. And then also what's really wonderful is when the primary care provider will send videos or pictures for us to view. So I think this has been an incredible asset to our toolbox.
That is great to hear. So I'm sure that this journey isn't over for you. What's next for Children's Wisconsin and Patient Journey?
This has been such a wonderful experience. We're really trying to continue to scale across our enterprise. Right now, we're able to send links to websites or teaching sheets. We're also able to send videos. We are hoping to continue to do that. So we have a sort of streamlined process for any new area or specialty or procedure that wants to become part of Patient Journey. We have an intake process so that we can build that out for them and are continuing to look for more use cases. One area we may expand into is primary care, especially with new babies and helping parents know what to expect around their baby's milestones and when they need to be coming in for well visits. And so just continuing to build out this tool into different use cases. Something else our digital health and experience team is looking at is more guided interactions that are bidirectional. So looking to enhance our platform that would allow patients and families to reach out to us instead of us pushing information out to them, that they could reply or start a new thread whenever they had the need. So we're evaluating that space right now.
And one goal for looking broadly at surgical care for families, we're hoping that if we can identify a useful tool that can be used in the EHR, that this is something that would be used across the surgical platform, not just limited to ENT patients, but any surgical patient. And ultimately, we'd love to share this on the community library for the EHR so that any hospital across the country can utilize this risk assessment tool. And now, mind you, it would have to, in terms of execution of using the tool, you'd have to make sure that you have resources set in place to do so. So I think that would be one limitation, but I think it's a start. Any start that you could have with a conversation about who is at risk making sure I identify those families and supporting them so that they can have the best experience possible as they recuperate from surgery.
Absolutely. Well, thank you so much, Dr. Soulman and Cronsell, for joining me today and sharing this really important, meaningful work that you're doing at Children's Wisconsin. It certainly does sound like your efforts to use a low-tech solution that extends patient care beyond the hospital's wall are improving the patient experience as well as your patients' outcomes.
Thank you very much.
Yes, thank you.
For more podcasts and additional tools, resources, and education to help you promote value in your community, please visit the Value Initiative's website at www.aha.org/thevalueinitiative. That's it for today. Thanks so much for listening.